Namaste and good afternoon. Greetings from all of us at Apollo Hospitals and welcome to our Facebook Live session. This is Dr. Srinidhi Chidambaram and I hope you're all staying well and keeping great health. We've been presenting Facebook Live sessions on key topics that each one of you should be aware of because knowledge is key to early recognition of diseases. And you know that early diagnosis leads to early treatment and better chances of cure. And when the information comes from top experts in various specialties, it's a great way to get factual and authentic details in this era of so many social media myths and misinformation. Today, we're going to discuss about a very important topic, which is lung cancer. It is the second most common form of cancer in the world and a leading cause of cancer deaths in both men and women. It's important to be very aware of this disease, about its risk factors, so that especially some habits like smoking cigarettes and other harmful tobacco products can be avoided by people so that this can be a big factor in the prevention of the disease. Lung cancer begins in the lungs, may spread to lymph nodes and other organs in the body, such as the brain. Cancer from other parts of the body can also spread to the lungs. Also, there are various types of lung cancer, and each one is different in its origin, its behavior, and in the treatment approach. So today, we are, we are going to discuss the different types of lung cancer. And I am very, very happy to invite Dr. Khader Hussain, who is a renowned specialist in thoracic oncology, to join us today. Dr. Khader Hussain is a specialist in thoracic oncology, as I said. He has over 10 years of experience. He is consultant in thoracic surgical oncology. His special areas of interest are in VATS, tracheal resection and reconstruction, and double sleeve lung parenchymal preserving surgery. He holds an MBBS degree from the University of Karnataka. He also is a diplomate of the National Board in General Surgery and also a diplomate of the National Board in Surgical Oncology. He has a fellowship in thoracic surgery and a fellowship in general thoracic surgery from the Shanghai Chest Hospital as well. Dr. Khader Hussain has the credit of performing India's first radical pleurectomy with HITOC. He has performed over 200 minimally invasive thoracic surgeries and the first in India to perform the highest number of robotic thoracic surgeries. Welcome, Dr. Khader Hussain, to this discussion today about the types of lung cancer. And it's so kind of you to join us. So let's begin by first asking you, what is lung cancer?
So the lung cancer is the cancer that usually occurs in the lung. So what people think that it is not only in the lung, it is also in the windpipe tree we call as the bronchus. That also includes within the reach of the lung cancer. So the lung cancer is one of the top three commonest causes for cancer, both in India as well as in the world, actually. As you correctly said, it is the commonest cause of mortality-related death, especially in cancer patients.
So who is most at risk for developing lung cancer, or what are the risk factors?
90% of the people who are at risk for getting lung cancer are all smokers. People who continues to smoke almost 20 cigarettes per day for almost 15 years, they are at quite high chance of getting lung cancer. That means that 90% of the lung cancer is because of smoking. The second most important risk factor in the world as well as in India particularly is in air pollution. The people who are exposed to the air pollution is also at risk for getting lung cancer. Something what we call as a passive smoking. Even the passive smokers are also at risk for getting lung cancer. It's quite common in Northeast where people still try to use the household stoves where they try to inhale the gases and the mixtures, which causes lung cancer more commonly in women. The other risk factors are people who really work in industrial areas like radon factories, aniline dyes, petrochemicals, cotton factories. They're all at risk for getting lung cancer. So all these people who are generally working in these industrial areas should get a periodic clinical examination by the treating physician or the surgeon and get it checked thoroughly so that they can be detected quite early, the lung cancers.
So what would be the earliest and common symptoms of lung cancer?
Generally, to start with the lung cancer, early lung cancer is generally asymptomatic. Whenever the patient generally comes to us, it's slightly advanced. So mostly the patient present to us with a coughing of blood, what we call as whenever the patient coughs out, there's a thin streaks of blood coming out, probably fresh one or an altered one. The second most important symptom is the chest pain they say. The third very important is the shortness of breath, especially when they try to exert themselves or try to walk on the staircases where they have a shortness of breath. Fourth is unexplained weight loss, unexplained loss of appetite, and any bony pain. Any bony pain is also one of the cardinal warning symptom of lung cancer.
So, is there then not a possibility that lung cancer can be detected early?
The only way, if you want to detect lung cancer early, is by screening the patients who are at high risk for getting lung cancer. I'll tell you a scenario. See, because of this COVID pandemic, so what happened is everybody got the CT chest done it. And we found in our institute 18 patients who were detected with COVID were harboring a early lung cancer. So even though COVID has done a detrimental effect on the public, but if you look at my angle, it has also done a good thing for a few patients where we were able to pick up early lung cancer patients because of the COVID positivity. These patients never had any symptoms relating to lung cancer, but because of the COVID, we were able to detect less than 3 centimeter and all were doing well. And most of them are 90 to 95% of all were detected early and they were all cured. That's the most important message I want to give it to you is that the only way if you want to cure the lung cancer should be detect early. If you want to detect early, you should get screened regularly.
So, how is lung cancer diagnosed? So, when you talk about screening, what should one really do?
Yeah, generally, when the patient comes to the clinic, we go by symptoms. One is by symptoms of the symptoms which is related to the lung cancer is one. Second is we image the patient by do a CT scan and other allied imagings. Suppose we do a CT scan, we found any nodule in any part of the lung. We will do a biopsy, especially if it is in the periphery part of the lung, outer part of the lung. We do a CT guide biopsy. Suppose if it is the central part of the lung, what we do is we put a small endoscope through the nose, which goes into the windpipe and sees any lesion within the bronchus. That is the windpipe, which goes to the all bronchus on the right side as well as on the left side. So there are two ways. One is by endoscopic bronchial biopsy. The other way is by CT guide biopsy.
Are there any for other tests apart from this which can detect the lung cancer? Are there any blood tests, for example?
Yeah, the blood test is very important, especially if the patient is having a distance metastasis. For example, if we think that the lung cancer spread to the other organs, then something called as the tumor mutational burden we call. So you can sample the patient's blood and see how much is the tumor burden is there. And based on that, we can also come to a conclusion that how aggressive the lung cancer and how aggressive we should be in treating those patients.
Right. The next thing will be about the staging of the lung cancer. So once it is detected, how is it staged?
Generally, it is staged by a PET CT scan, which we call as a layman as a cancer scan. So we try to do a PET CT of the whole body and try to stage it, whether is it confined to the lung or it has spread elsewhere, anywhere. For example, the first thing from the lung, it goes to the local lymph nodes, we say, lymph nodes. From the lymph nodes, they go to the adjacent organs like brain, the liver, the bone, and other things. And the other modality for diagnosing staging is we call it as a endobronchial ultrasound. For example, if the tumor is 3 to 4 centimeters in the center part of the lung and we don't have any lymph nodes in the mediastinum, in the chest, what I mean. So we do a ultra endoscope through the bronchial tree and we sample the nodes, especially the mediastinum. And if that becomes positive, then it becomes stage 3 in those patients. So one is by PET CT scan, the other one is by endobronchial ultrasound guided FNAC.
So what would be the stages of lung cancer really?
Stages of the lung cancer, ma'am. Stage 1, stage 2, stage 3, and stage 4. Stage 4 is where it has spread to the distant organs, and stage 3 is which is confined only to the loco-regional area. See, the biggest advantage of staging is we can prognosticate the patients. Those were the era where even stage 2 and 3 were not curable 20, 30 years back. Now, if you look at the strategy now, with the help of a lot of technology and a high end of immunotherapy, targeted therapy has come, where the cancer management in the lung cancer has been a big revolution. Even stage 3 patients now, 70 to 80% are curable. Even in stage 4, 10 to 15% are now curable if the factors are governing them in a very well way.
Let's now talk a little bit about more about the role of smoking and the use of tobacco products in lung cancer. So could you tell us a little more about how it really affects the lung?
What happens is when the patient or when the public smokes, it contains nicotine and coal tar, and also the smoke per se, which is highly carcinogenic. So what happens? The patient inhales the smoke. The more you deep inhale the smoke, it goes inside, almost reaches the terminal part of the lung, and damages the something called as what we call as the epithelium, we say, the lining layer of the lung. So it damages microscopically, and there is a chronic irritation, and this brings some such changes in the cells, which undergoes a lot of mutational changes. In spite of having a lot of checkpoint inhibitors, it keeps on changing, and the day it comes where it is not able to repair the cells, and that becomes mutated, and that becomes a cancer. So this is quite common, especially the guy who's a cigar smoker. It's quite less common in pipe cigars and people who are taking that cocaine, marijuana, and other opium products. But it is mainly because of cigarette, which contains smoke, nicotine, coal tar.
Do non-smokers also get lung cancer?
Yes, doctor. See, now the incidence of smokers, the incidence of lung cancers in smokers is also slowly rising. This is probably due to a passive smoking or more exposed to the air pollution. That is one. If you look at the strategy now, the 10% of lung cancers are genetically mutated now. So that could be a contributing factor for more number of patients have been diagnosed with lung cancer, especially in a non-smoking people. 90% are smokers, 10% are non-smokers.
So now let's come to the types of lung cancer. So what are the different types of lung cancer and how do they all differently behave? Or are they all basically the treatment and the diagnosis, everything is the same for them?
No, it depends upon the type. There are basically two types of lung cancer. One we call as a small cell, the other one is called as a non-small cell. Once we say it's a small cell, it is a much more aggressive lung cancer when compared to the non-small cell. So the predominant modality for treatment for small cell becomes chemo and radiation. There is no role for surgery. If you detect with non-small cell lung cancer, we have 4 types, because adeno we say, squamous we say, then adenosquamous we say, then we say is the bronchoalveolar, like so many subtypes are there. The most commonest now is adenocarcinoma, is slowly rising up. Previously, it was squamous cell carcinoma because of smoking. Now, the adenocarcinoma has become much more common than squamous. Then adenosquamous, then bronchoalveolar, and something called a salivary gland type of tumors also occurs in the lung. The good thing about the subtype of lung cancer is adenocarcinoma, generally they do well than squamous cell carcinoma. And squamous do better than both combined together of adenosquamous. And the most dangerous variety is adenosquamous, something we call as a large cell undifferentiated tumor of the lung, and other very rare types like sarcoma of the lung and neuroendocrine tumors, especially the large cell.
Right. So which is the most common type of the lung cancer that you're saying?
Now the present era is adenocarcinoma. Non-small is the commonest type of lung cancer, both in men as well as in women.
And which is the rarest type?
The rarest type is, as I told, is among the non-small cell, it is adenosquamous, the rarest type. But if you took overall, lung sarcoma or lung lymphoma is the rarest tumor that we can ever see. Maybe out of 1 lakh patients, we may see either 1 or 2 patients a day. Even our experience in Apollo for the last 2.5 years is only 4 patients we have seen sarcoma of the lung.
Right. So now we'll talk a bit about the treatment for lung cancer. So treatment according to the types, can give us some details about not only the treatment, but also some of the latest modalities in treatment also in detail.
So the treatment mainly, you have 5 kinds of treatment. I'm going to talk in detail about the non-small cell. As I said very clearly, the small cell needs only chemotherapy and radiation. So we are going to talk about the non-small cell, which is the commonest type of lung cancer, both in the world as well as in India. So once you've been detected with non-small cell cancer, suppose it's an adeno or a squamous, whatever it is. So we stage the patient. So according to the stage, we treat the patient. There are 5 types of treatment that is available. One is surgery. The other one is chemotherapy, where we deliver the drug through the veins. The other one is the radiation. The fourth one we call as the immunotherapy. That is the latest treatment for lung cancer, where our own body try to produce antibodies against those cancer cells. That is what we call as the immunotherapy, we say. Fifth is something called as a targeted therapy. So what we do is, whenever the patient has been detected with lung cancer, completely we do a genomic profile. And we see, is there any mutation that has occurred in these kinds of patients? Suppose any mutation is positive, then we target that mutation. That's called as a targeted therapy. So this targeted therapy is available for both for adeno as well as squamous, for both. So once we stage it, suppose for example, if the patient has got a stage 1, stage 2, and in stage 3, we are called A, B, C. If it is up to stage 3A, we do an upfront surgery, followed by chemo and radiation, if necessary, based on the final pathology report. This immunotherapy and targeted therapy is generally we don't give for stage 3A patients. From stage 3B, stage 3C, and stage 4, we give immunotherapy as well as targeted therapy. So what is surgery? Those days where we were using an open surgery, where we used to cut open the chest, cut open the ribs, the chest bones, 25 to 30 centimeter incision, patient has to stay for a month, lot of bleeding, lot of pain, morbidity is very high, 30 to 40% of the morbidity was there. The mortality was more than 5 to 10% of each lung cancer patient's surgery. So there was a revolution in that. So now what we do here is a minimally invasive thoracic surgery, where we have 2 types. One is called as a video assisted thoracoscopic surgery, like what we do a keyhole in the abdomen, same thing we do in the chest. The next generation is the robotic thoracic surgery. So what big difference it makes is we just put 3 to 4 small holes, which is 1 to 1.5 centimeter incision, and do the surgery inside the chest. Like how we do an open surgery, same thing within a small incision we do. We do, and we finish the surgery within 3 to 4 hours. And the biggest advantage is less pain, less bleeding, early ambulance, early recovery. You can go for your work within a week. The biggest advantage is you can start your adjuvant treatment if necessary within a week. Those days, adjuvant treatment were prolonged for more than a month. If you prolong your adjuvant treatment for more than 2 weeks by science, then the outcome of the disease is not great as what it was. So this video assisted thoracoscopic surgery has made a big revolution in that. Next comes the robotic, which is still more precise, 10 times magnified, still less blood loss, less pain. Of course, the cost is the same. 8 millimeter incision, patient can go home on the 3rd day, start the treatment by 5th or 7th day of the surgery. This is also more precise. The robotic surgery as well as thoracoscopic surgery can be done for any stage. That is not a contraindication for that, but you need to select the patients. The other technology, what we use, something called as image-guided thoracoscopic surgery. Suppose by screening, where we see a small nodule which is less than 3 or 4 millimeter, you can't do a biopsy. You cannot find out the nodule. It's not so easy to find out the nodule within the lung. So what we do is under CT scan, we find out the nodule through a wire and guide the wire into it, then shift the patient to the OT, take out that particular nodules, send it during the operating time for frozen section for histopathology, confirm it's a cancer. And if it is a cancer, we do a standard surgery. If it is not a cancer, then we just close it and come up. So this is a one-stop treatment for the patients who are suspicious for lung cancer, especially less than 5 millimeter. These called as image-guided bands. This we have done almost 10 cases here in our Apollo Institute. The other revolution is something called as a tubeless bands. So every time, whenever we do a surgery in the chest, we put a ICD chest tube, we put a epidural tube, we put a Foley's catheter for draining the urine. But what we do is something called as a tubeless bands, where we don't intubate the patient, we give an IV sedation, we put a laryngeal mask airway, and we try to do the surgery on the lung when the patient is ventilating. And the advantage is when the patient is ventilating, you can do the surgery. Whoever is unfit for surgery can also undergoes the surgery, and recovery is also fast, and the patient can go home the same day or the next day. Of course, you have to be quite vigilant and select the patients, and once you keep maturing it, you can do a complicated surgeries. So these are the big revolution in surgical aspect. Then comes the chemotherapy. Chemotherapy is generally given 4 to 6 cycles once in 21 days through your veins. Because of the chemotherapy, initially you can have some fatigue or some loss of appetite, vomiting, and immunosuppression. But over a period of time, everything you'll regain and you'll come back to the normal. Then comes the radiation. Radiation has got a regular radiation. We have something called as an external beam radiotherapy, where it has got a minimal side effects. Now we have got a proton therapy for the lung cancer, where the side effects are almost negligible. You can target which area you wanted, and the patient can go home without having any side effects or lesser side effects when compared to the conventional radiation. The fourth one is immunotherapy, which is easily applicable now, and it is mostly available in all parts of India. And this has become a revolution in the treatment of malignancies, especially lung cancer. We have seen after giving immunotherapy, lung cancer has almost disappeared. There are a few patients that almost disappeared. This also is one of the big technology we have there. And the fifth one, as I said, complete genomic profile. Anything is positive, we give the tablet for the target mutations. So these are the 5 kinds of treatment for lung cancer. So public should not be afraid of lung cancer. Now the technology is there where we can cure the lung cancer patients, especially 70 to 80% and 10 to 15% in case of advanced lung cancer.
That's really wonderful news, Doctor. So finally, we will just ask you to advise our viewers on prevention of lung cancer. What are the steps that one can
you cannot prevent the lung cancer. Its only thing is you have to identify the people who are at risk for getting lung cancer. For example, smokers, air pollution, industrial workers. They should get screened periodically. For example, the CT test in India costs us less than 3,000 rupees. So they can done it every year, and if they found the CT test is normal, and if they continues to smoke, they can keep doing every year. There's nothing harm in doing a CT scan every year. There's no detrimental effect. And if they do continuously for the next 5 years, and they need not do the CT scan every year, they need to switch out every 2 years, and up to the 10 years, then every 3 years, it's like that. See, the biggest advantage of people who stop smoking, suppose I've been smoking for a quite long time and I've stopped smoking now, I am at a risk for getting lung cancer for next 15 years. But at the same time, once I stop the smoking, for me, the chance of getting lung cancer comes down by 80%. So that's an important message for the people who smoke, actually. They should get periodically screened. And once they stop smoking, they are at risk for next 15 years. But at the same time, 80% of the reduction comes down for them. These industrial people also should get a periodic clinical examination, get a simple CT test done, and detect the lung cancer early. The only way to cure lung cancer is detect early. If you want to detect early, please get it screened. People who are at high risk for getting lung cancer.
Right. So thank you so much, Dr. Khader Hussain, for this wonderful discussion. So viewers, I do hope that you found this discussion illuminating and you've had a good overview on lung cancer, the types, and also the modern and the latest technology and treatment strategies that are now available to treat lung cancer. I hope that you've also received insights about prevention aspects, what to do if you're at risk, and also to largely avoid harmful practices like smoking. So do gift your lungs oxygen and not tar. Gift your body with good exercise and not the heart and lung disease. And gift yourself the value of good nutritional food and a good lifestyle and not harmful practices like smoking. That will really help you to preserve your health for a long time to come. Do subscribe to our YouTube channel to get the latest information on health. And also remember that we are available on all the social media channels, so you can reach out to us at any time for assistance or for further information. So till we meet again, stay safe, stay healthy. Thank you and namaste.